Let's discuss the best way to determine which surgery is right for you. Well, the first thing that comes up always is how much weight would you like to obtain? And then we always discuss the risks associated with each surgical option. With gastric banding, you can expect approximately 20 to 50% excess weight loss. With the sleeve gastrectomy, you can expect approximately 50% of excess weight loss. Gastric bypass will enable you to lose 50 to 80% of excess weight loss. One similarity between all three procedures is the fact that they all restrict the amount of food you eat. They do this by creating a small stomach pouch. When evaluating all three procedures, including gastric banding, the sleeve gastrectomy, and gastric bypass, the bypass procedure is the only surgery that changes the digestive tract and the absorption of nutrition. The way this occurs is when the stomach is attached to a different part of the small intestine, usually decreasing the length of time along the small intestine where absorption occurs. It is important to understand that with gastric bypass, you may experience nutritional deficiencies. This should not occur with gastric banding or the sleeve gastrectomy. However, if your concern is the amount of weight loss you would like to obtain, gastric bypass does facilitate the largest amount of excess weight loss. In addition to this, you can expect several health conditions to be improved or diminished, including hypertension, type 2 diabetes, high cholesterol, coronary artery disease, acid reflux, and obstructive sleep apnea. Gastric bypass can be a very risky procedure, including the risk for stroke, blood clots, along with several other health conditions. Subsequently, it is sometimes more appropriate to begin with a surgery that is not as invasive, such as the sleeve gastrectomy. You can then always perform bypass at a later date. The sleeve gastrectomy is also restrictive in nature in the fact that it will decrease the amount of food you eat. However, it does not cause problems with malabsorption. You will not experience any vitamin deficiencies, protein deficiencies, or any type of anemia after this procedure. The gastric banding procedure is the only reversible procedure out of these three, which is simply restrictive. This means that it will decrease the amount of food you eat because of the small stomach pouch that is formed. All three major types of weight loss surgery, including gastric bypass, sleeve gastrectomy, and the gastric banding, are all beneficial and promote long-term weight loss. They also decrease your risk for chronic health conditions. It is important for you to discuss with your health care provider which surgical option will be best for you.